Good morning and welcome to Boston Outlook. I'm your host, Julee Marra. On the line with me this morning is Mirissa Price. She's a third-year dental student at Harvard School of Dental Medicine. Welcome to the show.
Thank you so much, Julie. It's great to be here.
I'm glad to have you. As I was saying off the air before we started, I can't believe that the last time I had a conversation with somebody from Harvard School of Dental Medicine was 2 years ago. And time has just flown so fast.
That's right. I can't believe it's been 2 years since Sarah was on the line.
Yeah.
And it's great that you're taking this time again to talk about oral health.
The importance of the conversation. I mean, it's something that I feel like people tend to overlook, especially when it comes to children. And I'm going to throw this right out of the gate. I have a newborn at home, and one of my thoughts was, should I be doing something to, clean her mouth? I mean, we brush our teeth every day. Clearly, she doesn't have any teeth, but I feel like it's something that nobody directs you about.
Well, first of all, congratulations. That's so exciting.
Thank you.
Is it a little girl or a little boy?
A little girl, yeah. She's about 2 months old, and she's just the best thing, but...
Congratulations.
Thank
what
you.
a lot of people don't realize is even from a young age, there's so much we can do to take care of our children's teeth. So before they have teeth, we can be rubbing their gums with a wet towel just to get them used to the sensation of having something in their mouth. And then as they get that first tooth, that's when we can actually start brushing their teeth with the normal toothpaste that you would use in your mouth.
Really?
So we don't recommend you use the full amount that an adult would use, but just a smear of toothpaste, and it's perfectly safe, and it can help keep their teeth nice and strong from a young age.
Wow. See, I wouldn't even think about that. The teething process is something that I'm actually quite nervous about because we haven't gone through it. This is our first child, so we're like, that's another stage that's coming soon, you know?
Yeah, there's a lot to look forward to as your child is developing her teeth. And what's actually something that most people don't realize is that the time she gets her first tooth up to the age of 1 is really when she should see the dentist for the first time.
Really?
If you see a dentist, they'll be able to take a look in her mouth and really give you some advice about what to expect, what's going to come next, and if she's developing normally in her mouth.
So are there specific pediatric dentists that we should be seeking out?
Exactly. So most general dentists should be comfortable doing what we call a knee-to-knee exam, where they examine your child's teeth essentially on the parent's lap. But if a general dentist isn't comfortable, you can see a pediatric dentist, and they can refer you to one as well.
Okay.
And a pediatric dentist has that special training to be able to work with kids of all ages, any behavioral complications, even the young ones who don't want to open their mouths or want to bite down right away.
Right. I mean, I remember myself as a kid going to the dentist. I thought it was better than going to the doctor, but I didn't think it was a picnic by any means.
Oh, that's great. I'm actually glad that you put the dentist and the doctor in the same sentence. What people don't realize as well is that seeing a dentist is a lot like seeing a doctor. So we like to talk about dental disease in the dental community as being a chronic disease. It's something that you have to manage with your doctor and that you can work to prevent and maintain your health. But in order to do that, you have to be seeing your dentist as regularly as you're seeing your pediatrician or your doctor.
So a dentist, I mean, typically you recommend twice a year, right?
Exactly. Twice a year for those exams and cleanings, and then more if it's necessary. So if you're in pain or you have a chronic dental condition.
So I know that sometimes access to this care isn't always there for people, and that's something that Harvard School of Dental Medicine is working towards with your event on February 3rd, right?
Exactly. So preventing dental disease starts at the community level. Not just dentists, but pediatricians, families, educators. We all need to come together in order to create access for the children who don't have care. And so that's what we're doing at Give Kids a Smile at the beginning of February. On February 3rd, from 9 a.m. to 12 p.m., we're going to be hosting an absolutely free dental care event for kids ages 1 to 17, where families can come. Their children will go on, we call it a treasure hunt, where they'll get a treasure map. They'll be able to stop at different stations, like a craft education station, an overall wellness station with Harvard Medical School, and then, of course, the dental chair, where they get a free cleaning, free exam, free sealants and fluoride varnish, and they'll be able to get any referrals they need or make future appointments with the dental office. What we want with this event is that the children not only see a dentist, but that they establish a dental home so that we can really maintain good oral hygiene for our kids from a young age.
I remember getting those sealants as a kid to prevent the cavities, right?
Exactly.
I mean,
those are probably the easiest thing that a kid can get, which is why we like to do it right at this first event.
I totally remember that. I used to put my tongue up on the thing because it felt so smooth when it was done.
Yeah, that's always fun is those sealants, you get to wear them down on your own. So I remember as a kid, my tongue just gravitated right to it.
And then, of course, the whole braces thing came in, and my mouth was a disaster when I was a kid. I mean, it on, the outside appearance, it looked fine. It looked healthy. I had a good smile. And then somewhere around 12 years old, they had found that I had a tooth growing sideways up in the roof of my mouth, and it caused this whole big thing. And then they were like, oh, not only do you have that issue, but you have 3 teeth that don't have a permanent tooth underneath. And I think the last conversation I had with Sarah 2 years ago, she said that was so normal, that a lot of people don't have a permanent tooth under a baby tooth.
It is actually. So we were taking a tally in our own dental school class, and we were surprised that only one of the students in our class actually has that.
Really?
Because it is so common. We see that a lot. So if you can actually keep that baby tooth nice and healthy from a young age, there's a chance that you can keep that baby tooth throughout your entire life.
My dad is in his 60s, and he probably doesn't appreciate me saying that on the air. But I'm pretty sure he still has one or two that are still kicking around. And over the years, I think it's probably just started to kind of decay. So some of them maybe not even there anymore. But when they knew that I had that problem, they actually had to put a cap over it so that it would fit the rest of my mouth appropriately.
Right. So the baby teeth are a different size. But like you said, if you see an orthodontist, if you see a dentist from a young age, they'll be able to direct you if you need braces or if you need those other adjustments so that your teeth can develop normally.
Absolutely.
Actually, the first time we start evaluating a child to see if they even need braces is as young as 6 years old.
Really?
Some conditions, if you have your jaw growing a certain direction, a certain way, we really need to intervene early, which is another great reason. If you get into that dentist early, the cost and the length of your orthodontic treatment later on can decrease so much.
Wow. I mean, when I was a kid, I just remember, the teenage years. That was kind of the middle school, 6th, 7th grade. That's when everybody started to get braces. But 6, that's really young. Is that kind of not a new approach, but has research found that, over the years since when I was a kid, probably 20 years ago, maybe it was different from then to now?
So when we're looking at kids as young as 6, what we're looking at is called interceptive orthodontics. So it means that we know that a problem is developing as they're growing, and there's something that we can do to change their growth patterns so that the problem doesn't get worse when they get to those teenage years. That way, when they do get to their teens, they probably still will need those braces, but they won't need them as long. You won't see them wearing as extensive equipment, like all the headgear necessarily, when they're teenagers. You also won't end up seeing them in braces until they're 17 or 18. They'll be able to get out within a few years time period.
That's fantastic. Just to have that, to have it go so much quicker. It was always just part of the routine, I guess. Every month you'd have to go, you'd get new elastics, and that was the big thing. You picked out the colors based on whatever time of year it was, and
the orange ones for Halloween.
Yeah, exactly. Right? Orange and black, you had to alternate, it became kind of a fashion statement. But now they have even the technology where you don't even see the physical braces. A friend of mine just had, I forget what it's called, the Invisalign or something that looked almost like a retainer that he put in, and nobody knew he even had it.
And what's great about that is, so we think about orthodontics and braces for kids, but a lot of adults actually are going back to the dentist now and saying, my bite doesn't feel right, or I want my teeth to look a little different. And with Invisalign, you can do that without making everyone at work see that you have these metal bands on your teeth.
He said that it was because he didn't wear his retainer, I think, as a kid.
Yes, yeah, our teeth have a natural tendency to go back to where they originally grew in. And so those retainers, even though I remember my sister as a kid never wanted to put hers in, But, if she had put those in, her teeth wouldn't be shifting.
Right. I know. And I mean, I put mine in for, I don't know, a number of years. I don't wear it anymore, but in the back of my head, sometimes I'm like, could there be a shift like 15 years later?
There really could be. If it's been 15 years and your teeth haven't shifted, chances are your teeth are pretty solid where they are now. But there can always be a shift. Even if you lose a tooth later in life or at a young age, your teeth are going to shift in.
Interesting.
Which is why, so if, for instance, people ask us, why do we need to take care of baby teeth? And one of the things we need to remind everyone is that baby teeth are holding that space for permanent teeth. So whenever you lose a tooth, all the other teeth want to fill in that space. They want to fill in the gap. And then all of a sudden there's no space for that permanent tooth to come out.
Oh.
And you end up in a situation where the tooth is erupting into the palate, into the roof of your mouth in the wrong spot. And you end up needing that orthodontic treatment in order to get the tooth back into place.
Yeah, and that's what I had. I wonder if it was because I had a gap in between the two front teeth. If that's why.
Also, that gap that you're talking about, the diastema, I had one of those too, actually. That's another very common thing. Almost 97, 98% of kids have that when they're really young. And it starts to decrease as you get to the teenage years. But we actually expect to see that in young children because their permanent front teeth, if you remember that kind of like chipmunk look, are a lot bigger than your baby teeth. And so that space is partially there to hold open an area for your permanent teeth to come in.
Interesting. Very interesting. Yeah, that whole, like, I did have the tooth going sideways, as I said earlier, and they had to do this whole big thing where they did like an oral surgery, and there was a chain that they attached, and they had to literally pull it down like probably millimeter by millimeter, month by month, and finally it got into its spot.
So you probably know dentistry better than a lot of people in your community. I'm sorry you had to go through that.
Yeah, it was, that was, may that be the worst that has ever happened, right? But yeah, that was no picnic by any means. And I'm just thinking, geez, I wish, and I had gotten to the dentist, routinely. It wasn't like, there was neglect on my mouth or anything, but I think it's just one of those things where maybe they just didn't know to, kind of be proactive as they are today in 2018.
Yeah, and a lot of the tools that we have, so I'm sure they had the tools when you were growing up as well, but it's even more common now when a child comes in and they're 11 years old, we're looking for where those canines, those sharp, pointy teeth are coming in, and we're taking special x-rays so that we can see that they're developing normally. So something like you're describing is happening, we know and we're able to prepare for it.
Right. Yeah, I mean, I from what I remember, I think it was like, oh, and by the way, this is happening and you need to do this like pretty soon. Otherwise, you're going to lose all your teeth, So, the overall effects of like if you don't treat something as serious as what we're talking about here, I mean, can it really turn into something where you're losing all of your teeth, or if it's like giving you sinus trouble or jaw trouble?
Definitely. So the reason we're looking for where your teeth are erupting is if your tooth is erupting in the wrong spot, what it can actually do is start to break away the teeth next to it. And then the teeth that are healthy and normal in your mouth are going to be lost and they're going to be compromised. They might start to get loose. They might not even be able to make it into adulthood.
Wow.
And in addition to a tooth erupting abnormally, a lot of people have just dental decay, normal cavities. Cavities in children are actually 5 times more common than asthma in children.
Really?
And at least half of kids have dental decay by the time they get to the 1st grade.
Wow.
And so something as simple as a cavity in between 2 teeth can cause the same space problem that we're talking about with a tooth erupting in the wrong spot.
Wow. So how do you prevent the cavities in between the teeth?
That's a fantastic question. So I'm sure you saw the article that came out about flossing. And while there's a lot of skepticism, we always get the question about whether flossing is important. What we in the dental community recommend is that you really do introduce floss to your children at a young age. If you introduce it to them when they're 2 or 3 so that they see this string material entering their mouth, then by the time they're 4 and 5 and their teeth are coming together, they'll be able to better tolerate having something go between their teeth so that you can really clean out the debris.
I always struggled with flossing. I mean, even as an adult here today, if I floss once a month, and it's like with one of those little picks because I could never get a good groove with using the string floss.
Yeah, those picks are a lifesaver.
Yeah.
But, even if you're on the T or in the car and you forgot to floss, you can pull one of those out. And those are doing essentially the same job. What we want to make sure, just like with the regular floss, you can wrap it around the tooth. With those picks, we just want to make sure you're brushing alongside both teeth instead of just going up and down.
Yeah, I know. Some of the toothbrushes too. Like I bought one that was like this big high tech thing, and just like the regular type of toothbrush, not an electric one. And I couldn't get it to clean my mouth the right way. I don't know if it was too big. I never realized that there was such size discrepancy and different bristles on a toothbrush. And I'm being completely serious as an adult in her 30s right now, because my dentist would always
there's almost too many options.
Yeah. We would always just get one at each cleaning, and I would just use that, and it was fine. And then they stopped giving the toothbrush at the cleaning, so now I got to go buy my own, and it's like it's like rocket science.
Well, one thing that we are sure to do at our events, the event that we're having Give Kids a Smile, is that we not only give the toothbrush to the child, but we're also giving it to the parent and providing some instruction on how to brush your teeth. There's actually an effective way to brush your teeth that involves just moving your hand in a circle instead of making stroking motions. And so that's something that we can show your child and the parents as well. And we like to give the toothbrush as well to the parents because what a lot of people don't understand is that dental disease is caused by bacteria. That means that it can be passed from the mom or dad to the child just by sharing a cup or a straw.
Huh.
And so taking care of your child's teeth starts by making sure your mouth is clean and free of that bacteria.
It's, I remember a few years back, there was this whole big thing about how your oral health can affect your overall health, specifically like heart disease and those types of problems. Is that still something that's being researched, or are they looking more into that with patients?
Definitely. So the mouth is amazing because one of the things, if you have a chronic disease, a systemic disease to your whole body, we can see it in the mouth sometimes before your doctor can even detect it.
Wow.
Beyond that, your gum health is very closely linked to things like diabetes, heart disease, and even pregnancy outcomes. We know that preterm delivery is associated to the health of your gums.
Interesting.
Additionally, if you have an infection in your tooth is connected to your body. And so what we want to do is get to that infection before it spreads to your bone and at worst your bloodstream so that we can really make sure everything is contained and clean.
So when you say that, they can make these identifications through the mouth, like, is it just through like the physical oral exam, or is it like through x-ray?
So if we're looking at, for instance, somebody who has Crohn's disease, is something that a lot of people might know about. It's a digestive condition. We can actually see different ulcers on the gums in your mouth that can help us make that diagnosis. If we're looking at dental disease, what we really need are those x-rays. You might know them as bite wings, those 4 pictures that we take on each side of your mouth so we can see in between the teeth. The teeth are so small and so close together that we really need to be able to take a radiographic image to see if there's any decay.
It's interesting because I feel like through this conversation this morning, I feel like there's still some sort of a gap between the dental community and, the healthcare, I guess I'll call it. I mean, obviously dental falls under that umbrella as well, but talking more of like going to your doctor for your physical and that sort of thing, I feel like there's still a gap between the two communities.
There definitely is. So dental decay is something that we like to think of as a chronic disease. So we, in the dental community, consider it like a heart disease or diabetes, where it's highly preventable, but you do have to work with your dentist in order to prevent it. And you have to do a lot of home care in order to prevent it. And what we're trying to build at Harvard School of Dental Medicine and Harvard Medical School is that there needs to be an integration between medicine and dentistry. The dentists are increasingly trying to talk to the doctors and the doctors with the dentists so that we can actually work together. If you have a chronic heart disease, we want to make sure that we as dentists are talking to your cardiologist so that we are all on the same page and working together to fight this disease. Similarly, if you have a young child, your pediatrician can now actually put fluoride varnish on your child's teeth to help keep them strong in case you're not getting to that dentist for another 6 months.
Wow. That's all new. So that's progress.
It's amazing. It's great that we're seeing this. And what's even more fantastic is a lot of kids just don't have access to dental care. And so if they can see a pediatrician and that pediatrician can provide a little bit of care and education in the meantime, it's great for the dental community that we can work to reach those kids knowing that they're still getting some care.
So on Saturday, February 3rd, the Harvard School of Dental Medicine is hosting Give Kids a Smile. And I understand you need to book an appointment soon for this, right?
That's right. So we do welcome walk-ins, but we highly recommend that families call to schedule an appointment. If you have multiple kids, you can schedule those appointments at the exact same time. We'll have enough providers so that your children can be seen at the same time and there's no wait for the family. To book that appointment, you call 617-432-1434 and press option number 1. That phone line is open during business hours, Monday through Friday. You can also leave a message at 617-432-2045. And I just want to add that Give Kids a Smile is not a program that's only done at Harvard School of Dental Medicine. Ours is on February 3rd, but this is a program that's run throughout the country, throughout the year. So it's been in effect from the American Dental Association Foundation for a number of years, actually since 2003. And in that time, more than 5.5 million children have been cared for by more than 500,000 volunteers.
Wow.
And so we're just excited as Harvard School of Dental Medicine to be able to contribute to the Boston community and bring that program locally.
That's so important. And like you said, it goes on throughout the year. Is this the only event that's being hosted in the Boston area this year, or will there be others?
So that's a great question. Our goal with this event isn't just to provide one day of free care for families. So what we at Harvard School of Dental Medicine are working to do is if we identify that your child has dental disease that needs, for instance, a filling, we actually have a scholarship fund available for some families so that they can come back to our normal clinic hours at no cost to the family and get that care that they need. We really want families to be able to view Harvard Dental Center as a dental home and return without fear that they're not going to be able to provide their child that care.
So what's the process like for the event on the 3rd? It's open to anybody? You don't need to go through some sort of screening, I guess?
Exactly. It's completely open to the public. As I said, we recommend you call for an appointment, but if you forget and you're just walking by, feel free to walk in with your family. And when you come in, what you can expect is essentially a treasure hunt. The entire clinic is going to be decorated for kids like a pirate ship. Your children will get that treasure map and be directed to different crafts and games, obviously to the dental chair and exam, and then to a medical area with Harvard Medical School. And we're not going to be asking for any information in terms of insurance or finances. All we want to know is your child's health. We want to be able to help you and the family build good oral health practices at home. And we're there to answer any questions that you have.
So this is going on 9 to noon. Is that right?
That's correct. Yeah, it seems like a short time period, but we have a volunteer staff of over 60 people that will be there working hard so that we meet all of the needs of the patients that come in.
Wow. I mean, I can only imagine how quickly those 3 hours are going to go by for you guys.
It's amazing. You know, when there's kids in the clinic, it goes by so quickly just because there's so much laughter.
So what's your role going to be the day of Give Kids a Smile, February 3rd?
Well, I'm excited because this year I'm a third-year dental student, and so the graduating class of 2019 and 2018 will be providing dental care to the kids. So hopefully I'll be in the clinic as well. I'm also, as a coordinator, going to be all over the clinic. So one of the activities we're going to have for kids is actually a game where we have a giant tooth structure and the kids can throw objects on the tooth and learn what kinds of things stick to the tooth and what things you can use to get it off a tooth. And so I'll be behind the scenes dressed in a tooth costume helping out with that as well.
That's cool. So
It'll be a fun experience.
I bet. Is this your first year doing the event, or have you done it for the previous 2 that you've been a student?
I've been fortunate, so I work closely with Sarah Tijani, who was on the air with you 2 years ago. I worked closely with her when I was in my first year of dental school and have actually been a coordinator for all 3 years now. And I'm also a Give Kids a Smile ambassador, leadership ambassador with the American Dental Association Foundation. which means I went to the main event in St. Louis where they actually help hundreds of kids in a one-day time period.
Wow.
And it was just a fantastic experience to see how we can really build our program here in Boston. So that's what we're hoping to do this year.
Are you from Boston, or did you come out here just for school?
I came out here for school. I'm from Arizona and Colorado.
Wow. The Arizona climate is very different from here, but Colorado, I mean, they're similar sometimes, right?
Colorado is pretty similar, but
Yeah.
Arizona was a nice 82 degrees when I left around Christmas time.
Wow. Oh, man. So, yeah, you were in for a treat as 2018 started, right?
Oh yeah, yeah. We don't have to worry about snow days out in Arizona. That's
No,
for sure.
the for sure is right. So what made you want to get into dentistry?
Oh, I was one of those kids who knew I wanted to be a dentist when I was 7 years old.
Really?
I was incredibly curious and climbed on a brick wall, ended up falling down and losing my front tooth. And the dentist woke up in the middle of the night, came out in his flannel pajamas to restore my smile. And I knew I wanted to do that for other kids.
Wow.
And then as I learned more, I realized it's really an art and a science.
Mm.
And by just helping someone smile, you have the honor of helping build their overall health. And it's just an incredible gift to be able to do that. So I'm so proud.
Absolutely.
I'm so happy to be here at Harvard Dental School.
That's awesome. Congratulations to you. I know you got, a year to go?
A year and a half to go.
Wow. So let's see. Next summer, you should be ready to take on your own?
So my graduation year, yes, will be May of 2019, and I'm going to be going into pediatric dentistry,
Fantastic.
which is why I'm really closely involved with Give Kids a Smile.
Yeah.
I want to be able to provide care for kids who don't have that access to care, and for kids with special needs who really haven't found a provider who can work with their needs.
I think it takes a special kind of personality, too. I feel like it was like a haircut that my husband and I were talking about, like how, you just have to be like a certain type of person to work with children. They're not the same as adults.
Yeah, it definitely takes a certain personality and a good sense of humor. A good day when you're working with kids is you only get 1 or 2 bites on your fingers. And so not every dentist wants to put up with that.
Yeah, I know.
It's a special privilege to be working with kids because
Absolutely.
we see the kids before they have dental disease ideally. And so we're really working more on the prevention side.
Totally. Well, we've had a great conversation. We've been chatting with Mirissa Price. She's a third-year dental student at Harvard School of Dental Medicine. Again, Give Kids a Smile. It's a free event happening Saturday, February 3rd, just a couple weeks away. Let's just recap the information for that event specifically in case people just joined us and missed out on how they can get involved.
Definitely. So we're hosting Give Kids a Smile at Harvard School of Dental Medicine. That's at 188 Longwood Avenue, which you can get to on the D line to Longwood Station or the E line to Longwood Medical Area. And to make an appointment, you can call 617-432-1434, option number 1, or leave a message at 617-432-2045. You can also find us just by Googling Give Kids a Smile Harvard. And we have a Facebook page. We have a lot of information out online so that you can easily find information about our event.
One thing about the Google search that I want to throw out there, make sure you type in 2018 because if you just search Give Kids a Smile in Harvard, I think you get the info for 2016 because that's what I had found when I was doing a search. So just a tip there.
Thank you for letting us know. And we'll go ahead.
Yeah.
We'll go ahead and update. I know 2016 has a separate Facebook page. Both Facebook pages are going to, as of an hour from now, we're going to be reading information about the 2018 event.
Perfect.
So we'll make sure that it's accessible.
Perfect. Because I don't want people to miss out, especially if this is something that they're interested in, or maybe they couldn't get to you guys last year or the year before because, it probably, I don't want to say sells out, but it fills up, I'm sure, where, you run out of appointments to accommodate. So hopefully everybody that is interested can get involved. Get your appointment early. We're giving you a couple weeks heads up here. So take advantage of that. Mirissa, thank you so much. A great conversation. Best of luck to you in your final year and a half at dental school.
Thank you so much. And thank